the taboo of dying. There is a finality to life. One day it will end. My journey in palliative care started in 2002 when a friend asked me whether I wanted to join a private hospital, which has just started their Hospice Centre. And 2 years later, I felt it was time to come out into the community to start Charis Hospice. Charis Hospice is a free community palliative care provider. In our country, we use the words palliative care and hospice care interchangeably in the community. However, because hospice care is very much a taboo word to many people, so let's use the term palliative care for now. Palliative care is not very known in our community, even though it's been around for probably about 30 years now. So what is palliative care? It's compassionate whole person care offered to those with life-threatening illnesses. And the whole person care involves more than just physical care. Very often we think of medical care as just looking at the physical body. It is much more than that. There is the other aspects of care, that is emotional, psychosocial, and spiritual care. And these are actually all interrelated. We need to look at the patient compassionately. And every patient is different. In palliative care, we emphasize quality of life issues more than quantity, that is duration of life, but it's very subjective. Quality of life differs from person to person, but that's still our focus, to find out what is meaningful for the patient and or the family and work towards that where possible. How long more do I have? Is a question that the patient often asks the doctor. And as doctors, sometimes we ask ourselves what we call the surprise question. If your patient pass away within the next 6 months, will you be surprised? And if I as a doctor think that no, I will not be surprised, that can be the prompt for me to refer the patient for palliative care support. Physical symptoms are probably one of the easier symptoms to care for because you have medications to use. But when it comes to emotional symptoms, there are no pills that I can give you. That's when my team needs to connect with the patient at the heart level. And patients are not going to open up to strangers like us until and unless they have some rapport. And often rapport comes through the physical context that we make with them. So that's why it's very difficult for us to optimize our care for the patient and the family if you have very limited time with them. Especially when the patient is actively, if I may use the word, dying, and everybody, the patient and the family members, are very agitated. That's very difficult to explore emotional issues. So when the referral comes to us, that will initiate the process. My medical team is divided into geographical area because we cover the whole Penang Island. So depending on where the patient is located on the referral form, that referral will be directed to the primary nurse of that area. So once my nurse has made contact, she will then arrange with the family to make a physical visit in the house. Then the other thing that my nurse does at the first visit is to assess the patient, of course, physically, emotionally, and then we come up with a plan, goals of care for this patient. The non-medical team comprises the administrative and finance team. We are a tax-exempt company, so every dollar and cent has to be documented. The other aspect of our non-medical team is the development. Development part is where the staff will keep networking with the public to increase awareness of palliative care, to advocate for palliative care, and to do the fundraising. Hospices being started by NGOs all over the world have given their services for free. But in actual fact, you know that our services cost because you need a well-trained medical team and you need good staff to handle the other aspects of your work. as well. But still, we don't charge in the community. I would say the very first thing, be more aware of this. Be our ambassador, know more about it. Then you can tell others who need our services. You can tell others who can support us. And that's how the ripple effect will work. We will keep educating the public. We will keep raising awareness. We will keep talking about it. The taboo of dying. There is a finality to life. One day it will end. And I like to see that more and more healthcare personnel practice the basic approach of palliative care, which is to look at the patient as holistically as possible by giving compassionate whole person care.